Okay, thank you. Welcome back. We are finishing up our day at day 2 at HIMSS. I'm Nick Jeans from Better Health, and we are with Omar Hussein from Imprivata.
Hi, Nick.
Hello, nice to meet you. Thank you for coming. Imprivata, based in Massachusetts, my home state, has some interesting technology, and I'm not sure all of you guys will be aware of it, but single sign-on technology is really important for me in the emergency department, and important for I think a lot of people, because a lot of hospitals have different logins for their radiology, for their lab, for their charting systems, and a single sign-on technology can simplify that. Now, how does your company simplify single sign-on?
Well, it's a very complicated problem that we try to make very easy for clinicians. It's all about simplifying the workflow so that doctor has one kind of authentication, and a lot of our customers use finger biometrics or a smart card or proximity card, and then we basically automate all their other logons. And so they don't have to remember to the passwords, they don't have to reset the passwords, they're automatically logged on to all the other applications. And with that, we can then manage all their sessions. So if they log on to one machine, they go from one machine to another machine, and they don't have to log on again. When they authenticate, whatever they had opened on machine A will come with them and roam with them to machine B.
Wow. So you offer services like a proximity card, so they just have to walk up to the machine, or if they have a finger, they can just use that too.
They can use their finger too.
Wow, and right away they're into all the services that they might need.
Everything they need, and also the convenience of managing, not only just having to shut things off, but when they go to some other place and let's say they're seeing a patient in a patient room, and then they walk to see a specialist and they want to talk about that patient, they don't have to log on again. They put their card down, and whatever was open on the monitor A will transfer all the way to the second workstation.
That's really cool. Now, I imagine it must be really technically demanding to get all these different systems to kind of cooperate and agree to this single sign-on, or is there some kind of system that you've
There is a good system. We don't actually touch any of the back-end applications. We do everything on the front end, on the desktop, on a workstation.
So you don't have to make the packs adjusted or anything like that. No. You don't have to. Okay.
You don't have to modify anything.
Does that slow things down though, to have this layer on top of everything else?
How many doctors do you think would tolerate a slow system?
Well, we tolerate it already.
No, it doesn't slow things down. It actually makes things much faster, because if you think the average doctor might open like 3 or 4 applications every time they see a patient, now they just have to authenticate once and they don't have to do it multiple times. And we all know that, with HIPAA, ARA, and the HITECH Act, there's a lot of regulations, so passwords keep getting reset, which causes a whole new set of problems, because people go up, a patient is sitting there, you log into your clinical information system, and guess what? You can't, because you forgot the password.
Well, I know we've got an interesting group following us in the chat room, and they've got a lot of questions.
A lot of questions. Okay, first is, what's the lag to log in from the time I walk up to the terminal?
About 2 to 3 seconds.
About the time to hand over this microphone.
Thank you. Okay, next, does it log me out when I walk away from the computer?
Great question. We have a new product we just announced at HIMSS called Secure Walkaway, and what Secure Walkaway does is exactly that. It knows who's in front of the machine, and when that person walks away from the machine, it automatically logs the machine. It actually doesn't log you off. It shuts the screen down. If you walk back to the machine and you're the original user, it will give you your session. If a new user comes up to the machine, it will ask them to re-log in.
So if we went like this, it would just go blank. Okay. And then it would
come back. It would come back on.
You gotta love that. That's pretty cool. All right, more questions.
Okay. How about sometimes there's a doctor taking care of a patient, a nurse taking care of a patient. Can you use multiple roles for the same chart?
Yes. Yes, that's a very common scenario. So a nurse may be at a patient and charting, and then we'll call the doctor in to prescribe some medicines or renew their prescriptions. And in that kind of scenario, you would have multiple people accessing the same, and that's all set up and configured.
Well, that probably is a limitation of the electronic medical record that you're building on top of. Yeah,
the limitation of the record in the system rather than us.
Yeah. Okay.
How close can the terminals be to one another, basically to keep me from being logged into several boxes when I walk up to a row of them?
Another great question. Because the technology is based on not proximity, the actual walkaway security is based on a camera. You can have multiple stations right next to each other. As long as you're facing the workstation you're working at, it will notice that you're the person in front of it, take an image. When that image is not within a particular radius, then it will, when it's not in front of the screen, it will automatically log you off. For proximity, you can either badge in, like tap like you do your badge ID when you enter the door, a building card, or a finger biometric, but that's on the machine. So you just tap that machine and that machine will activate.
So you can't just walk by a row of computers and they'll all turn on and they'll all turn
That kind of
off.
proximity, that's from about a 1 foot, 2 foot out proximity never works. It has always been a problem implementing that technology.
So does it do facial recognition, and which EMRs do you currently work with?
So I'll answer the second question first. We work with all EMRs because it's not dependent on an EMR system. It doesn't do facial recognition. It does imaging. So it takes an image of the person that is in front of that workstation when they are logging on, whatever means they take. And that image then could be this, it's got a facial element to it, but it's also got a silhouette element to it. And so that's where our secret sauce comes in. So we're not doing biometric or facial biometric authentication. We're just taking an image of the person in front of the machine. When that image is no longer in front of that machine, it will automatically shut the machine down or go dark on the screen.
I wonder if you could have some kind of system, or in your testing, in your trials, did you ever have like two faces show up at the same time and one of them walked away? Or, this is the geek in me
No, those are great.
trying to game the system.
Well, when we did our usability testing, we did it typical environments and edge cases. We did people, you're logging in, someone standing behind you over the shoulder, two people close together. And so the system is actually smart enough to know who is the primary person at the time that they are actually typing in and logging in. That's the image that gets captured, and it filters through everything else around it.
Wow.
There's a lot of intelligence built into it.
It sounds like you've given this
Specifically for healthcare.
you've given this a lot of thought. You had another big announcement this week, is that right?
Yes, we introduced another product called Privacy Alert, which is focused on helping hospitals monitor patient privacy. So if a patient complains that their records have been, unauthorized access to it, VIPs that come into hospitals to know someone who's snooping and seeing that VIP's records, this monitors the logs of who's been accessing the information and can let hospitals know whether clinicians that are part of the care providing group are the only ones seeing that data and others are not seeing the data.
Again, so this is a feature of a lot of electronic medical records, or some, but you're providing a kind of standard platform for the lab data, the radiology data, everything.
Exactly. What we're doing is essentially helping hospitals enable safely and securely electronic medical records. It's great to put things on electronic form, but if you don't have the adequate safety provisions and security and simplify its access, it won't work.
Okay. And do you advertise to patients that this hospital now is equipped with our system, so call them at this number if you want to find out if anyone's.
No, we let the hospitals do that.
Okay.
Yeah.
Okay. Well, thank you. We've had Omar Hussain from Imprivata here with us at HIMSS 10, Day 2, and very interesting stuff from your company. Where could we find more at this booth at HIMSS?
We're at booth 8808, so if anybody wants to take a look, we are running a bunch of demos and a good environment built there to show you actual working situations.
Okay. And for our friends following along in the chat room,
www.imprivata.com, and there will be all sorts of pods on it, and our blog, and also our WebExes that they can download and take a look at.
Okay. All right, exciting stuff.
Great.
Thank you
Thanks
very
a lot.
much. Thank you for
Appreciate it.
coming.
Bye-bye.